Asamoah is not a partisan person. I don't belong to any party. I cannot belong to any party. In fact, I hate the party system. I have hated party system all my life. Because a group of people who are selfishly always thinking of themselves and that group of party members. So what I'm going to talk about today has nothing to do with politics or parties or some kind of favoring or disfavoring another group. Today's story is about health in Ghana, especially the hospitals, clinics, and health institutions in Ghana. I have noticed from my personal experience, by personal experience, I'm talking about when I returned from overseas in 2004, I found that the nation is lacking health facilities to take care of sick people, especially those in incidents, accident patients. I've been to Komfo Anokye Hospital not long ago, and I went to the emergency area. And what I saw there is mind-boggling. Komfo Anokye Hospital is supposed to be a major health institution in Ghana, and especially Ashanti region all the way to the northern part of the country. In fact, if you take Kolebu Hospital, Komfo Anokye Hospital is the biggest hospital that is supposed to serve the populace. But I think there's something going on that is not right. When I visited this place less than 2 months ago, I saw more than 50, close to 100 patients. Some of them with broken legs, some head injuries, hand injuries, and you could see blood coming. And all of them on the floor. I saw only 3 people on bed, on the floor, with parents, brothers and sisters and mothers and fathers with them, all sitting on the floor. Maybe it is the volume of patients or sick people coming there that has made the place so saturated, so congested. Maybe the volume is too much, more than what the hospital can take. But seriously, I think something should be done. There has to be some way of relieving emergency patients. Emergency, I'm talking about emergency attendants. I was so shocked, and you see ambulance, about 2 or 3 ambulance vans outside. Sometimes you are there, you hear bah, 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 ambulance bringing somebody, and you see the person is on a bed or being carried by 2 or 3 people rushing to the emergency area. And you see blood coming. And when you look at those who are there already at the emergency level, you see they need help, emergency help. But I don't know, it's probably there's not enough staff to take care of this emergency situation. Or maybe the management is not aware of this problem that is happening out there. I hope the health ministry and people in charge of our health, the Ghanaians' health, will look into this and find solution to this. I can imagine at emergency ward, emergency area of Komfo Anokye Hospital, seeing about 50 people lying on the floor and crying with blood on them. It's not right. It's not right. Health ministry should look into this and find solution. That if anybody is brought to the emergency, the word emergency means that prompt attention, no delay. Person should be received right there and be handled right there to save life. You know, I don't know if the ministry is aware of this thing. I saw, and I think I should bring it to the public to make the people in charge be aware of what's going on. I'm not sure they are aware of this. You know, and I'm sure it's not just Komfo Anokye Hospital. It is possible all other hospitals. In emergency situation, people die recklessly. They die because there's no prompt attention. That patient, that person that has been brought there requires. It's crazy. I think something should be done. I don't know what should be done, but I think the staff, maybe, I don't know, doctors or nurses or emergency staff. You know, I remember going to one of the staff room, and this nurse didn't want to talk to me. She said she was busy. But there were two nurses. I didn't see a doctor. Two nurses attending to a patient who have had head injury with blood on it. And the lady could not communicate directly with me. She told me she's very busy. Please stop. She warned me. And I understand that. I shouldn't have done that. But I went around to see if I could find about 2, 3, 4 rooms that is taking care of emergency situation. Either there's lack of staff or equipment, or I don't know, there's something. All I'm pleading is that people in charge of this should look into this area. The emergency is emergency. It's a life risk period that people's life can be saved, or injury can be contained, or can be sustained, that it will not end up in a very bad situation. There's something that needs to be done. I'm going to show you some pictures. You know, I was prevented not to take pictures of this thing by the security people of the area. But I found my way to get some pictures. And you could see what I'm talking about. If something happened to you right now in this area and you're rushed to the hospital, you will be rushed to the emergency. You will be rushed to the emergency. And if you go and there are about 10 or 20 people on emergency waiting to be attended to, you will be the last number. And if you're lucky, maybe within 10, 20, 30 minutes, you'll be attended to. By then, you may be dead or a situation may be critical. So I am pleading to the chief administrator of Komfo Anokye Hospital in particular, and the health ministry, regional health director in Kumasi, and also the regional, health minister. Please set up a body to go to find out why there's delays in attendance of emergency patients. You could be a patient. I could be a patient. In a critical times that you need critical attention as soon as possible. And to stay there without attention for about 10 minutes could be suicidal. It could be deadly. So my petition is that, well, I'm just an ordinary person, but I've seen something that I think I should bring to the public. Maybe people responsible are not aware of what's going on. But I have seen this personally, and I think something can be done. Something can really be done. If it's a shortage of staff, we have nurses college, university-trained doctors and specialists of all kinds in the health industry. But when they finish training, they don't stay here in the country. They all find their way to Europe and Americas, because that is where you can get money, good pay, good attendance, and so forth and so on. But if we show critical need of this staff, these new graduates, nurses and so forth, if we show need for them, before they even finish their training, there is a location, there's a job offered right there. From the college or university, you go straight to this hospital or that clinic. That will keep them active in their professional areas. We should find a way, in fact, the Ministry of Health should find a way to reduce the amount of health professionals leaving the country to other countries. We need them here. What I saw in Komfo Anokye could be lack of staff. We don't have sufficient staff. That's why emergency patients just lie on the floor. Again, can we get beds, some kind of temporal bed that a patient could be placed on at least for about 10 minutes or 30 minutes before being attended to? Please. Samaya, sometimes I talk too much, but what I talk about is something I've seen as something really necessary for somebody to talk about. What I saw at Komfo Anokye Hospital is very, very sad. And I was imagining myself being a patient on the ground like that. If something happens to me and they call emergency ambulance to bring me to the hospital, there's no bed they can put me on. I will be on the floor like the others on the floor, waiting for nurse or doctors to attend to me. And I may be dead. You know, so these are things that concerns you and I, that the leaders of this nation should take care of, should take it as an emergency need. It's very, very important. Very important. And I'm going to show you some pictures that I took there secretly. They didn't want me to take any pictures. The security prevented me, but I found a way to take some pictures. You could see what I'm talking about. There's evidence of it. So I'm going to end here. I think the health ministry and the health industry should do something about this. Because you who is watching or listening could be one of these people in an emergency situation that your life could be saved. But because there's lack of attendance, you may die recklessly. So I'm going to end here. That I think maybe in future I have to see the chief administrator of Komfo Anokye Hospital, see if there's anything that can be done or that I can do to improve the situation. So I'm going to end here. Thank you so much.